Now, before we go on to examine the cranial nerves, I want to speak a bit about the functional and the anatomy of the cranial nerves. There are 12 cranial nerves, as you all know. The first cranial nerve, or the olfactory nerve, carries the sensation of smell from the olfactory epithelium to the parahippocampal gyrus in the temporal lobe. The second nerve, or the optic nerve, carries the sensation of vision from the retina to the occipital cortex via the temporal and the parietal lobes. The third nerve, or the oculomotor nerve, arises from its nucleus in the midbrain. It carries motor fibers to all the extraocular muscles of the eye except the superior oblique and the lateral rectus. It also carries along with it parasympathetic fibers which arise from the Edinger-Westphal nucleus in the midbrain. These parasympathetic fibers supply or innervate the ciliary muscles. The third nerve serves as the afferent limb of the pupillary reflex. The fourth nerve is called the trochlear nerve. It supplies the superior oblique muscle of the eye. The fifth nerve is the trigeminal nerve and has multiple functions. Sensations from the head and face are carried via the three divisions of the trigeminal nerve. The ophthalmic, maxillary, and the mandibular divisions carry the sensations of pain, temperature, touch to the nucleus in the pons. The trigeminal nerve also has motor functions. It supplies the muscles of mastication, namely the temporalis muscle, the masseter, and the lateral and the medial pterygoid muscles. It also serves as the afferent limb of the corneal reflex. The sixth nerve, or the abducens nerve, is another pure motor nerve which supplies the lateral rectus muscle of the eye. The seventh nerve is also called the facial nerve. It supplies all the muscles of facial expression. The chorda tympani nerve is a part of the facial nerve which carries sensations of taste from the anterior two-third part of the tongue to a structure known as the nucleus tractus solitarius, which is located in the pons. There are also parasympathetic fibers which innervate the submandibular and the sublingual glands. This is responsible for salivation. The eighth nerve, or the vestibulocochlear nerve, is a pure sensory nerve which receives input from the cochlear ganglion and the vestibular ganglion, and these nerve fibers terminate in certain nuclei in the pons and the medulla. They are responsible for hearing and position sense. The ninth nerve, or the glossopharyngeal nerve, carries sensations from the palate and the pharynx. It also serves as the afferent limb of the gag reflex. The 10th nerve, or the vagus nerve, supplies motor fibers to the muscles of the palate, pharynx, and larynx. It also carries with it parasympathetic fibers which supply the visceral organs from the neck below, which means the vagus nerve has varied functions from heart rate variability to modulating the gastric peristalsis. The 11th nerve is an accessory nerve. It supplies the sternocleidomastoid and the trapezius muscle. And the 12th nerve is a hypoglossal nerve which supplies the muscles of the tongue. Now, if you notice that most nerves have different functions. However, we can classify these nerves into pure motor nerves or nerves which supply only muscles. These are the fourth nerve, that is the trochlear nerve, the sixth nerve, the abducens nerve, the 11th nerve, the accessory nerve, and the 12th nerve, which is the hypoglossal nerve. These have pure motor functions. There are also nerves which have a pure sensory function. For example, the first nerve, which is the olfactory nerve, the second nerve, which is the optic nerve, and the eighth nerve, which is the vestibulocochlear nerve. These carry pure sensory fibers. Most other cranial nerves have mixed function. Not only do they have sensory functions, they also carry motor fibers and parasympathetic fibers along with them. Now that we have learnt about the basic functional anatomy of the cranial nerves, let's go on to examine the cranial nerves from cranial nerve 1 to cranial nerve 12. The olfactory nerve is tested by first explaining to the patient that you will be asking him to identify certain smells. These are generally non-irritant smells, for example, a soap or coffee powder or even tobacco powder. I will ask the patient to close his eye and I will bring these odors in front of each nostril. With the other nostril closed, I will ask him to identify the smell. Hello. We are going to be testing what is known as the cranial nerve, and I will teach you and I will explain to you what I need you to do. Okay?
Yes.
Can you close your eye? I'm going to bring a certain smell in front of your nostril. Please identify what it is. Can you close your left nostril? Can you identify what this is?
It's coffee.
Okay, good. Can you close the other nostril? Can you identify what smell this is?
It's coffee.
Okay. The optic nerve has several aspects to its examination. The first thing that we examine is the visual acuity. Visual acuity is checked by checking both the near vision and the distant vision. The near vision is checked by using what is known as a Jaeger's chart. The Jaeger's chart has text written in different sized fonts. The patient should be able to read the smallest of fonts. This is what the Jaeger's chart looks like. It contains text of various fonts, starting from the smallest from top and with the increasing size fonts as you go below. The patient should be able to read the first 4 lines. Can you close your left eye? I'm going to ask you to read certain lines from this paper, starting from the top.
The northern countries of Europe scarcely deserved the expenses and the labor of conquest.
Okay, thank you. Can you close the other eye? I'm going to ask you to read from the paper again.
The northern countries of the Europe scarcely deserved the expense and the labor of conquest. The forests and the morasses of Germany were.
Okay. Since the patient was able to read the topmost line, this is considered a normal examination. Coming to checking for distant vision, we use what is known as a Snellen's chart. The Snellen's chart also has alphabets or numbers written in various sizes. The Snellen's chart is placed approximately 6 meters from the patient's sitting position. Each eye is tested separately. Due to space constraints, we may not be able to demonstrate this test. But let me explain how this test is done. If the patient is able to read only the topmost line sitting at a distance of 6 meters, the patient is said to have a visual acuity of 6 by 60. On the other hand, if he is able to read the bottommost line, the patient is said to have a visual acuity of 6 by 6 or 6 by 5. The 2 eyes are tested individually. Now coming to the third aspect of examination of the optic nerve, we look at the color vision. Color vision is tested by using what is known as the Ishihara's chart. I'm going to show you a set of colored pictures which have numbers in them. Tell me what those numbers are. All right? What is this number?
74.
This number?
6.
And this number?
Number 12.
Okay. The Ishihara's charts have numbers with different colors on them. If the patient is able to recognize these numbers, it means the patient doesn't have any color blindness. The next aspect of testing the optic nerve is checking for visual field. This is ideally done by the ophthalmologist using an instrument which is known as a perimeter. But in the bedside, this is how we go about looking for visual fields. This is called the confrontation test. I'm going to ask you to close your left eye, and I'm going to show my finger starting from the side of the visual field. If you can identify my finger, tell me yes. Can you see my finger?
Yes.
Can you see my finger?
Yes.
Can you see my finger?
Yes.
Can you close your right eye?
Yes. Yes. Yes.
The confrontation test is carried out by sitting 1 meter across the patient and moving your fingers from the lateral field or from the superior or from the inferior fields and asking the patient to identify whether the patient can make out the finger or the colored pin that you may use. The next aspect of examination is examining the pupils. The pupils are examined for their size, their shape, their reaction to light, and also for what is known as the accommodation reflex. I'm going to use a torchlight and shine this light in the patient's eye and look for reaction to light. That is what is known as the direct reflex, wherein after shining the light in the person's eye, the pupils constrict. This is associated with constriction of pupils in the other eye as well, which is called the indirect or the consensual eye reflex. The accommodation reflex is tested by asking the patient to fix his gaze at a distant object and then bring his attention to a finger that is kept close to his eye. What is to be noted is pupillary constriction and convergence of the eye. I'm going to shine a light into your eye. Tell me if it troubles you. Look at a point beyond my shoulder. When I tell you to focus on my finger, look at my finger. Can you focus my finger? Okay. The last aspect of examination of the optic nerve is looking at the optic disc. This is done whenever you have a direct ophthalmoscope available to you. The third, fourth, and sixth nerves are examined together because these are the nerves that supply the extraocular muscles of the eye. You have to sit across the patient and ask the patient to follow your fingers. As I examine, I will tell which muscles I will be testing. I need you to fix your gaze on my finger and follow my finger. All right? Can you see my finger?
Yes.
Please follow my finger. I'm looking for the lateral rectus of the left eye and the medial rectus of the right eye. This is testing the superior rectus of the left eye and the inferior oblique of the right eye. This is testing the inferior rectus of the left eye and the superior oblique of the right eye. This is testing for the lateral rectus of the right eye and the medial rectus of the left eye. This tests the superior rectus of the right eye and the inferior oblique of the left eye. This movement tests the integrity of the inferior rectus of the right eye and the superior oblique of the left eye. In each position of gaze, you have to ask if the patient can see a single finger or two fingers, which could suggest that the patient has diplopia. You also have to ask at which position of gaze the distance between the two images is maximum. We have just now checked the extraocular muscles, which are supplied by the third nerve, the fourth nerve, and the sixth nerve. Carrying on with testing of the third nerve is also the efferent limb of the pupillary eye light reflex. This is ideally done in a dark room. First, the light is shown into one eye. The direct reflex in that eye is noted, as well as the consensual pupillary constriction in the opposite eye is also noted. I'm going to shine a light into your eye. If there's any trouble, let me know. Shining a light will result in pupillary constriction of the left eye, but absent pupillary constriction of the affected eye. Coming to examination of the fifth nerve or the trigeminal nerve. As I said earlier, the trigeminal nerve has sensory functions. It carries sensations of pain, temperature and touch from the head and the face. I'm going to be using a cotton tip to test the sensations of touch from different parts of the face. I'm going to touch you with this wisp of cotton. You have to keep your eyes closed, and the number of times I touch you, you have to count 1, 2, 3, like that. Okay? Keep your eyes closed.
1, 2, 3, 4, 5, 6.
You can open your eyes. Now I'm going to test the sensation of pain. I'm going to use a small pin. It's not going to hurt you, but if it does, please let me know. Again, I'm going to ask you to close your eye, and I'm going to compare the sensation of pain on both sides of your face. Every time I touch you, you will have to count the number of times I've touched with this pin.
1, 2, 3, 4, 5, 6.
You can open your eye. The sensation of temperature is checked using test tubes which contain hot and cold water. The water is approximately 37 degrees Celsius. I'm going to be asking the patient to close his eye and identify whether he can feel hot or cold. You'll have to close your eye, and I'm going to touch your face, and you'll have to tell me whether it is cold or hot.
Hot. Cold. Hot. Cold.
You can open your eye. The next function that we are going to be testing for the fifth nerve is testing for its motor innervation of the muscles of mastication. We know that the muscles of mastication are the temporalis, the masseter, and the pterygoids. I'm going to ask the patient to clench his teeth, and I'm going to feel for the contraction of the muscles of mastication. Can you clench your teeth? Open your mouth. Close your mouth. If there is weakness of any of the pterygoids, the mouth or jaw will deviate towards the side of the weakened muscle. The last aspect of examination of the trigeminal nerve is testing for the corneal reflex. As we know, the afferent limb of the corneal reflex is subserved by the fifth nerve or the trigeminal nerve, and the efferent limb is subserved by the facial nerve or the seventh nerve. This is tested by using a wisp of cotton and approaching the patient's eye from the side. The patient is explained prior to you testing this. This is a wisp of cotton. I'm going to touch your eye with this. If there is any discomfort, let me know. Normally, this should not cause any discomfort. Keep looking at me. Touching the edge of the cornea elicits a response, which is closure of both the eyes. The last aspect of testing the trigeminal nerve is looking at the jaw jerk. The jaw jerk is tested by putting your finger on the patient's chin and gently tapping it with a knee hammer. A normal response is either an absent jaw jerk or just a present jaw jerk. An exaggerated jaw jerk is seen in patients who have bilateral pyramidal tract lesions. I'm going to gently tap your chin with this knee hammer. Can you open your mouth slightly? Coming to the examination of the seventh nerve or the facial nerve. As you know, the facial nerve supplies the muscles of facial expression. We are going to test each muscle of the facial expression to see the functioning of the motor aspect of the facial nerve. I'm going to ask the patient to frown or look up to test the frontal belly of the occipiter frontalis. Then I'm going to ask the patient to close his eye tight while attempting to open it. This will test the orbicularis oculi. The third thing I'm going to do is ask the patient to blow air into his mouth and tap his cheek. This will test the buccinator. Then I'm going to ask the patient to show his teeth, which tests the orbicularis oris. Can you look up? Okay. Can you close your eyes tight? I'm going to try to open them, but keep them closed. Okay, you can open them. Can you blow air into your mouth? Okay. Can you show me your teeth? Okay, thank you. The next aspect of testing the facial nerve is checking for taste sensation from the anterior 2/3 of the tongue. This is done by using a salt and a sugar solution. I'm going to ask the patient to protrude his tongue, and I'm going to use a solution that I'm going to apply on one half of the tongue and ask the patient to identify what solution it is. The patient is not aware of what solution I'm going to use first. Without the patient taking the tongue back into the mouth, the patient has to identify the nature of the solution. You'll have to put out your tongue, and I'm going to put a few drops of this liquid on your tongue. Without taking your tongue back into your mouth, you have to tell me what it is, whether it is salt or sweet. Put out your tongue. Close your eye. If you appreciate salty sensation, please lift up one finger. If you appreciate sweet, lift up 2 fingers. You can open your eye. The patient has to be advised to rinse his mouth before you use another solution. Now coming to the examination of the 8th nerve or the vestibulocochlear nerve. We're going to be examining the cochlear component of the 8th nerve. This is done using tuning forks. The tuning fork that is used is a 512 Hz tuning fork. We should understand the basic principle that air conduction is better than bone conduction. The RINNE'S test is going to test for both air conduction and bone conduction. The RINNE'S test is performed by first striking the tuning fork on a rough surface, followed by placing the tuning fork at the patient's mastoid process. The patient will be explained that when the patient stops hearing the vibration, he is to tell the examiner when it stops. Thereafter, I am going to place the tuning fork in front of the patient's ear. If the patient is still able to hear the vibrations, that means this is a normal test. As we said, air conduction is always better than bone conduction. I'm going to use this tuning fork and place it on the back of your ear. If you can appreciate vibration, please tell me. When you stop appreciating the vibration, please let me know. You're going to have to close your eyes for this. Can you make out the vibration?
Yes.
Has it stopped?
Yes.
Can you hear?
Yes.
In conductive deafness, bone conduction will be better than air conduction. The next test we are going to do is called the WEBER'S test. WEBER'S test is done by keeping the tuning fork on the patient's forehead and asking the patient to lateralize as to which ear the sound is heard better. In a patient who's got conductive deafness in the right ear, on keeping the tuning fork on the forehead, the patient will be able to hear the sound better in the affected ear. This happens because the influence of additional sounds is blunted out because of conductive deafness. I'm going to demonstrate the WEBER'S test in this patient now. I'm going to put this tuning fork on your forehead and tell me which ear you can hear the sound better. If you can hear the sound in both the ears, tell me the same.
It's the same.
In sensory deafness, the sound from the forehead will be localized or lateralized to the ear, which is normal. Now coming to the next set of cranial nerves, and that is cranial nerve 9 and cranial nerve 10. These two nerves are examined together. First of all, listen to the patient speak. Is there any hoarseness of voice, which could tell us that there is vocal cord paresis? This is best identified by an ENT surgeon. Also, ask the patient to drink water and look for any nasal regurgitation. Open your mouth. Say ah, ah. By making the patient say ah, we are looking at the movement of the palate and the movement of the uvula. If there is weakness on one side, the uvula and the palate will be shifted towards the normal side or will be deviated towards the normal side. Now, coming to what is known as the gag reflex. The gag reflex is carried out by using a cotton-tipped applicator, which is then touched in the patient's tonsillar fossa or the soft palate or the pharynx. This should elicit a gag. The response of both the sides should be noted. This is called the gag reflex. Now, we will be examining the 11th and the 12th nerves. The 11th nerve or the accessory nerve is tested by putting into action the sternocleidomastoid. The patient is asked to push the examiner's hand towards one side while the examiner notes the tensing and the bulk of the sternocleidomastoid of the opposite side. As you know, the left sternocleidomastoid pushes the head towards the right, whereas the right sternocleidomastoid turns the head towards the left. You will have to turn your face to the left and push my hand. Can you push my hand? Okay. Can you push my left hand? Okay. Examining the trapezius is another part of examining the accessory nerve. This is done by placing the examiner's hands on the patient's shoulder and asking the patient to shrug against resistance. I'm going to place my hand on your shoulder and you have to push my hand up. Can you do that? Okay, thank you. Movement of both the shoulders should be noted. If there is any weakness of the trapezius, there will be drooping on that affected side. The 12th nerve or the hypoglossal nerve is tested by first observing the tongue in the patient's mouth. Look for any fasciculations and any wasting. Putting the patient's tongue out will result in deviation of the tongue to the weak side. Can you open your mouth? Can you put out your tongue? Okay. That was all about examination of the cranial nerves.